Hello, everyone. This is Cole from the American Journal of Healthcare Strategy. I'm joined this evening by a special guest, Jonni. Jonni, please introduce yourself and your role.
Yes, my name is Jonni Smith. My real name is LaJean, but I go by Jonni. And I'm currently serving as the business operations manager for Inova Health System surgery service line.
Thank you so much for coming on. Happy to have someone from, of course, the operations, the business area. And it's also great because you were an administrative fellow and you recently transitioned to your role. And so we're trying to showcase the positive outcomes of administrative fellowship. So I'm excited to talk about that today. You started back in undergrad as a pre-med, and then you transitioned a few times. Can you tell us about how you came across healthcare administration?
Sure. So my journey was not necessarily a straight path. I definitely took a little bit to get to health administration, but very glad that I did. And as you said, I started off as pre-med, bio major my freshman and sophomore year. And I just found like the classes just weren't really resonating with me as much as I wanted them to. And it's not exactly the path I wanted to go down anymore. But then I started to think I do want to be in healthcare. There is some part of healthcare that was just had a calling for me, but I wanted to figure out a different path on how to be in the healthcare field. And so ultimately, I ended up switching my major sophomore year, I believe, feels so long ago, but sophomore year to political science. And at that time, Cal Poly didn't have a public health program. They came out with one a year later after I had switched. But I do not regret it at all. I loved my political science major. I had decided that I wanted to kind of take the health policy route and started to look into that realm. And I felt like poli sci would give me that nice blend of both healthcare and then the policy side. So that's kind of how I got into healthcare administration slowly. I had a mentor who was my next door neighbor, actually, who was in healthcare administration. And I started to, ask him questions like, what do you do in your work? And kind of explain to me what he did. And it really resonated. And I felt like it was a happy medium between being in healthcare, but not necessarily on the clinical side. So that's kind of how I got to healthcare administration.
Well, thank you for sharing that. And just to also talk about, you've moved around a bit, right? I see on the resume, Colorado, of course, California, and then also the East Coast with, Washington, D.C. Where are you from originally in the United States?
Yes. So I'm originally from Denver, Colorado. I am a big proponent of moving around. I feel like there's so much to see, so much to learn. So I actually went to Cal Poly University for my undergrad. I was recruited out there to play basketball. And so that's what brought me out to California. So I ended up being on the women's basketball team for all 4 years. And then after that, I came back home in Denver because of COVID, of course. I was a 2020 graduate. So took some time in between during the pandemic and then eventually went out to George Washington for my master's in DC. So been on both coasts.
How has playing a sport, has that benefited your career at all?
Yeah, I mean, I definitely think it has. I love being able to say that I was a part of being a student athlete. The schedule and the load of work that you have both within sports and within your school is just something that I think really teaches you time management. So for me, I think that was the biggest part is like being able to manage your time. It's a full-time job for basketball. You're also a full-time student. So the time management piece was a big portion that I think was helpful. I also just think that like kind of competitive energy and spirit still lives in with me. And I feel like, it's nice to have when you're navigating the business world to just have that energy of wanting to do better, always wanting to improve. And so some of that mindset, that kind of like athlete mindset, has definitely served me well in my role. And I definitely think people find it as like an interesting, talking point, I guess.
Oh, definitely. Yeah, I like encouraging people to look for some unique areas that they can express themselves and find ways to get their skill in ways that people might not have thought of, right? Like you said, the teamwork, the having the extra work to do, that's excellent. Your first experience we were talking about before the recording was in a jail, right? Your first experience with health, working in healthcare. How did that experience convince you or change your path at all?
Oh, yeah. So actually, I love sharing that story because, I don't think it's a unique, I think it's a very unique start to getting into healthcare. I had someone who came and spoke in our class for one of the public health classes that I took, and her story just really resonated with me. She was the CMO over the prison system in San Luis Obispo. And she was a student athlete when she went to Stanford, and she said that she went to medical school, but ended up wanting to be a health administrator instead, actually. And so I was like, oh my gosh, this is like completely speaking to what I'm going through, almost to my exact storyline, other than the fact that I didn't go through medical school. So I wanted to speak to her about why she chose to go into health administration, and just grabbed a coffee with her and was just mainly curious about her journey and what she learned from it and what advice she would give to me. And so it kind of reaffirmed my decision ultimately not to go the medical school route or the PA route. Just hearing how much she enjoyed administration. And I don't think she knocked her background of being in that medical field, but I just think that she spoke so highly of being an administrator, and that it's also an equally great path to be in. So we had that coffee, and I just had asked, or I think she had just asked if I was looking for any work or internship. And I was interested in policy work. And so ultimately in the jail, I helped do a couple policies for jail health. And I think that was a really unique opportunity as well, because, that's also, whether we like to think of it that way, a very vulnerable population. They don't necessarily get the best access to healthcare. And so being able to work on some policies to enact that was really great for me.
Uh, how big of a part has this networking and this reaching out to people, kind of putting yourself out there, been to the success of your career? Because sitting down with somebody like that for coffee, that takes boldness in a way, right? That's not something that I would have been able to do back in my sophomore year.
Mhm. Yeah, I think, that's something I love. It's actually kind of one of my like anxious tendencies, I would say. I kind of laugh about it with my friends because I'm like, whenever I'm feeling like a little bit lost in my journey or wherever I am, there's just so many experts ahead of me that I feel like you don't need to feel that way. There's someone out there who can help guide you, give you some words of encouragement, or just, give you some hindsight that are helpful. And so for me, I just think of it like as a way to help me inform my journey to make better decisions. And I actually, I love being able to give back to those like who are coming up underneath me and below me, to say, here's what I would have done, or here's how I thought of it. So I think it's just building that sense of community is really important. And then also, like, you never know what it turns into. I didn't go in with that conversation thinking anything about an internship. I was only wanting to just hear her story and, just learn more about her and get her perspective on where I'm at. And then it ended up being an internship. So you just never know what these conversations can lead you towards. And again, my first mentor led me and taught me about what healthcare administration is. So you just never know who helps you along the way. And I think I would not be here today without mentorship. So
I love that, and I love how you're here now doing that exact thing, right? You're helping, all these people who are going into fellowships for many years. This video will be up, and so it's so important. And I also like how you said you didn't go into it expecting anything. Just going into it to soak up the knowledge, and that's how you ended up getting this internship. So that's really cool. You went with GWU for your MHA.
yes.
Very popular institution. We've had so many of the classmates on from that institution. What made you choose it?
Yes. So for me, I was kind of deciding amongst a couple of different schools. For one, I knew I wanted to be in DC. My brothers and my father actually came out to DC for school at Howard University, and I was looking at that school as well, but they ultimately didn't have the program that I wanted. And so I looked. I was like, I still want to be in this area. I want to explore a different part of the country, and so And then also, being DC, we're a very policy heavy place. We have all the government jobs right here for us. So when I was still thinking about that health policy route, I thought it was a perfect place to be just in case I wanted to take some sort of internship in that route. So it was somewhat the proximity of just being in DC, but also, I mean, GW is very reputable for our program. I think that the alumni base is another thing that I looked at, and I actually got advice from that from a mentor, and they were saying like, look at their alumni association, like how involved they are, where they're at. So I started to explore that and really liked the outcomes that I saw, and then also how involved they were with GW, and definitely felt that as I went through the program. And then, yeah, I would just say that, I think it's just such a great program. It was one of the few that I was looking at that also was designed for young professionals. So a
Mhm.
lot of programs they want you to have more experience or, those type of things. But this was a program specifically designed for someone who doesn't have as much experience. So that was perfect for me personally. I'm speaking because I didn't have as much experience coming in. They help supplement that along the way throughout your program.
Um, I've heard so many similar things about GWU, and I also think it's like you said, that alumni network, and just for other programs who are trying to create equally as popular program as GWU. I like how you brought that alumni network out, because in our podcasting, we were just talking before the episode. You had spoken with two or three people who we had on
Mm-hmm.
that are in unrelated parts of the country, even in a way, right? And
Mm-hmm.
you're still in touch and you're still communicating with them so frequently. So I think that's just awesome, because
Yeah.
as humans, we want to be, talking with other humans. So I think that's really cool.
Yes, that we're not only like a group that really sticks together and like I met a lot of friends, which was great because there's also a lot of programs where it's like you're just going to school, you're not there necessarily to build a community, but I really felt like I felt a community of friends. That's like a testament to GW and I think the types of students that they get. But then also like the alumni really does give back their time. We have them do resume reviews with us, mock interviews, we have different Gibbs Oration is like our kind of annual meeting that we have with, and a lot of alumni comes back and they're able to do mock interviews with the first years. So just so much of giving back to the community. They come to our professional development class and speak to us about their career path. So you can tell people stay connected, and I just think that's such a testament to the program. And I think that was definitely a highlight of the program, and something that people should look for when they're going to apply.
Yeah, absolutely. I very much agree. And of course, your program is a 3 year, right? It has that administrative fellowship component,
Mhm.
right? As
Yes.
that's okay. You wanted to make sure. Yeah, so it's that
Yes.
3 year, which that's unique too. Not every program has that 3 year, fellowship kind of mandatory in a way component, right? Some are 2 year, some are 18 months, and so that's excellent that you were able to get a fellowship, and that they had all that infrastructure to support the fellowship. I think that's one of the unique parts of GWU, as you were talking about. Um, why Inova Health, right? Because that's still within that Northern Virginia, DC area, right? So how did you, come across them?
Yes. So I started to do, of course, a ton of research like you do for these fellowships. There's a lot out there. And so you just start to kind of comb through one by one all the different opportunities that there are. But I started to look mainly again because I was wanting to stay in the area. But then when I started to look into the fellowship, I was like, oh, I really like this rotational based program because that's what we are. We're a rotational project based program. You're set up with two different preceptors. You also get a year long mentor. So I liked that kind of support structure. And I think you get exposure to different service lines. So a lot of the parts of the structure of the program really were appealing to me. But then also when I started to look into this health system as a whole and just like their mission, vision, values, and kind of where they're going and the drive to be one of the best in Virginia. And just, I think the reputation that it has in Virginia was something that I wanted to be a part of. And I think they also have a very good focus on diversity and equity and inclusion. And so that was something that was also important to me looking at fellowships. And so one of the reasons why I also chose Inova was actually when I got to the on-site interview. And so I was able to take a tour of our Seville Cancer Screening and Prevention Center, and they were doing some really great work there. I really love the idea of doing some preventative work, more that population health focused lens. And though I didn't get to explore a lot of that in my fellowship, to be able to see that and to show that kind of showed where they were at as this health system. And they had a lot of great technology and research, a small research component going on there. So just seeing where they were pushing their direction. And then also just getting to meet the people and ultimately very connecting with the leaders. And so, I had multiple interviews, and each of the leaders just felt really genuine. And I could just feel this sense of like, we care about our fellows, we care about our people, we want to see you succeed. And that definitely translated in the fellowship. It's not one of those things where it's like not as advertised, like it is just as advertised, I think, if not even better. So it was mainly the connection with the people, but also just seeing the facilities and being able to see the great work that was going on. And there's just a certain energy that I felt as compared to some of the other on-site fellowships that I went to. I loved just the energy, I guess I could say, of the people and the health system as a whole. So.
And I have to ask because you're talking about these on-sites. How many programs did you apply for, and how many on-sites did you have?
Yes. So I applied for 11, about 11 fellowships, which is actually on the lower side as compared to what GW would probably advise, especially because we require a fellowship. But I took it as, and I give people who now reach out about fellowship advice the same advice. To me, I think I can be more intentional about where I'm applying to, and I can actually understand those health systems and be intentional about what I know about them, why I'm applying to them, why I want to be a part of their organization, versus if I'm applying to 30 something odd organizations. Though it is a very competitive process, I don't think there's any way I can know and really get to know these organizations on that level. So I ultimately decided to go on the lower end and was just strategic with where I applied to. And so my on-site interviews, if I can remember, I think it was about, I want to say, because I also applied to my internship at UC Health. So that counts as one. I think it was 3 or 4 on sites. Yeah,
Nice.
3, 4. So
That's a pretty good success rate out of the ones that you applied to.
yeah, no, it went great. And some of them are just at different paces. So I was in like first rounds or second rounds. It's actually a very stressful time for sure, because you're in first rounds with some of the programs, and then other programs you are in the final round. And so, decisions are coming up. But I think it was about 3 on-site interviews. So yeah, I had a pretty good it was a pretty good route with fellowships and yeah. So.
Great. And so you get into this fellowship, as you said, you really liked it during the on-site, so it must have been really awesome to get in. What was the setup like in terms of what kind of rotations did you do? Are there any projects that especially stick out in your mind?
Sure. So for my rotations, my first rotation was in finance, ambulatory finance. And so I knew that for me, finance was something that I needed to kind of get a little bit stronger in, and, wanted to increase my financial acumen. So I decided to ultimately take a finance rotation. And then the second rotation was with women's service line. And then my mentor was the CNO of Fairfax. So really great opportunity to get insights from each of those different leaders. So for a project that I worked on in finance, I'll just tell you a few of them that I worked on. I did anywhere from budget workbooks. I helped with some margin improvement efforts and initiatives. I also was able to work on more of the denials and rev cycle world. So those were a few of my finance projects. I really enjoyed the denials project just because it was data analytics heavy. So more creating dashboards and just being able to get insights out of that, which is something I enjoy. And then for my women's service line, it was a little bit more on the strategic side. So helping with some program development. And then in addition to that, you actually get a lot of system work. So we get projects from anywhere from in the system that our chief of staff might be working on as well. And so one of those was an innovation project and launching, doing some innovation work at Inova. That was a very interesting one and very different than I think any of the operational work that I was a part of, and just kind of made you start to think differently about the type of work that there is in healthcare. So lots of variety as far as projects go.
That is an awesome variety. That is really cool. Wow. And that's over a year, right? It's only a year long.
Yes,
Yeah.
yes,
So that's
every
a lot to pack into a year.
Yes. Yeah, it's definitely all about the I think that, basketball time management came in.
Yeah.
It's a lot different than probably like those 10-week internships that you do because those are usually like one project base. So having
Yeah.
to learn to manage your time, knowing where to prioritize, knowing what's urgent versus what's not, because you do have some issues where leaders are like, we just need to get this done and we need help on this. And this is more of an urgent issue, but you might have a lot of other projects going on. So definitely time management is key in a fellowship, I would say.
How confident are you now with your financial skills after that finance rotation?
I would definitely say there is so much to learn under the financial umbrella. You don't even begin to unpack it in your classroom setting. So I still think that I have a lot to work on as far as the technical skills, but I think I have a better understanding of how finance actually functions as it relates to a health system. So for me, I think the advantage of having this finance rotation was more understanding how finance flows through a system and how it impacts the system, how business decisions are made, what parts are under finance, what decisions are made in the finance team versus the operational team, and ultimately how it impacts the bottom line. So I think it's more so that I got that strategic level. What I think now I need to be more tasked with is getting that hands-on technical skills of finance.
Which you will, of course, in any kind of operations and business role.
Absolutely. So I'm very glad at least I have that more accurate lens of finance. And don't get me wrong, GW has a really great finance professor. There's a lot of things that I don't think I would have known without my finance class. So I'm very thankful for that class, even though it really pushed me during the program. It wasn't the easiest, but I think that both were necessary. And I think there's even more work needing to be done as far as that more, reading financial statements and just understanding what that means and how that impacts our bottom line and just being able to do that more technical work that a lot of operators actually don't get until later in their career or don't necessarily hone in on until later in their career. And I've gotten a lot of advice to like, if you can do this early on and you can get good financial acumen early on, then it will serve you well in your career. So try my best, but I wouldn't say it's necessarily my strong suit yet.
Why do you think it is, real quick, why people don't learn that until later in their career?
Yes, I think so much of it is, I think unless you do an MBA, a lot of MHA programs don't necessarily have that like intense focus of accounting finance. And so it's kind of hard to get like real hands-on work within finance. Not only that, I don't want to be presumptuous, but I don't think numbers are always everyone's favorite thing to deal with, but it's something you can't ignore when you're an operator. So it's very, very necessary, but I don't think it's everyone's favorite. You want to think about how can we improve this process or physician relations or quality or safety or all those other buckets that go under that might kind of take precedence over finance at times. But when you think about it, some people don't love the saying, some people do, but they say no margin, no mission.
Yep.
And I think that there is some truth to that. So you have to have some sort of focus on it. But I just think it's something people kind of avoid. I'll talk to a lot of my classmates and even me coming out of the program out of GW. It's something I never thought I would want a rotation in, but very, very grateful for it.
I think that is an interesting point because quality metrics and satisfaction metrics are way more exciting, right,
Mhm.
than financial metrics, I think, to most people.
Mhm.
And I saw that in the public health space too, right? BSPH students, they don't like finance. That's why they're in, public health. And then it's like, well, if I don't have any financial backing for this project, then it won't get done. So I guess I have to learn how to do this
Yes.
financial part. So I appreciate that. And so now, I know you're new into this role. It's you just started this month, right?
Yes. Yeah. Just last week was my official start date. Yeah. So.
Wow. So that must be an excellent outcome. Can you tell us how you got the role, and what the kind of generic title and job description is?
But so I can tell you a little bit about how I came into the role, and I think it's a great testament to the fellowship at Inova, and just how I guess much attention that they put into the fellowship. And so for me, actually, I had a leader that I had networked with a little bit, and it wasn't even intentional necessarily. It was more so just by way of being in the fellowship and connecting with him as a leader. He's a fantastic leader, one that I sat in a lot of meetings with. We went to the NAHSC, we're now calling it, organization. And so we went to that conference, and I was able to spend time there. And so just being able to have small interactions throughout the fellowship, I think, is something that fellows should definitely keep in mind. And so I think through those interactions and speaking to him, really appreciating him as a leader and just hearing him talk in these different meetings, definitely felt connected to in that aspect. But ultimately, he had came and said that there was a position open, and if I was interested to take a look at it, that it was definitely an open position. And so surgery was not necessarily on my radar at the time. It was ambulatory that I was looking at. But then, of course, I think it's so important to stay open to opportunities. And so I ultimately decided to go with surgery after just, again, being really connected to the leaders, learning more about surgery, service line. They're a great leadership group. I think I could learn a lot from surgery because we are all across the system rather than focused on one area. So it gave me another opportunity to explore more broadly. And then, of course, surgery is a revenue generator for most hospitals. So I feel like if you can learn surgery, you're able to translate to a lot of different areas further on along your career. But yeah, it's really a testament to highlighting the fellowship. Our fellows have done really great. We have 100% transition rate. So all of our fellows have transitioned to a role at Inova. We've only had one fellow who ultimately is not there anymore, but that was due to personal reasons and going to a different city. But they definitely look out for the fellows. I think, you have to put in the work as well and ultimately have to apply. But just the fact that, you have exposure sitting in those meetings, having those small interactions, going to conferences with them, I think is what ultimately landed both my co-fellow and I position. So.
Yeah, that is wonderful. Wow, thanks for sharing that. And again, congratulations on that new role. And so, have you had experience rotating at all, or being even adjacent to surgery in the past?
No, I actually haven't. I didn't rotate. I did the surgery project for finance.
Yep.
I had shadowed two surgeries in women's.
Yep.
They have their own OR, a separate OR from the ORs that we have, but I shadowed a surgery in women's, and that was my only exposure to surgery. And I actually had a lot more exposure to ambulatory, which was the route that I had thought I wanted to go to. But I think that I think the fellowship did its job. I think that's
Yes.
exactly what it's supposed to do. I think you're supposed to be able to explore broadly and look at other opportunities. Again, I think the leadership team was just with surgery. I'm very excited to be under them and to learn from these leaders. And I mean, Inova has incredible leaders in each area, so I couldn't have gone wrong. But very excited to learn under the surgery team because no, I have not necessarily explored that area before.
Which is great. I mean, because that means the opportunity for learning is massive, right? I
Yeah.
mean, that's really great. So yeah, so now you're going to have both that ambulatory expertise that you got during the fellowship, and now that more inpatient surgical hospital expertise. So you're really, setting your sights on a COO role eventually.
Hopefully, that would be nice, definitely.
That's awesome. Well, thank you so much for coming on, Johnny. I really do appreciate your time this evening, and it's great to hear about the successful outcomes at Inova. Not just yourself; you were saying all the fellows have been really successful, so that's wonderful.
Yeah, my co-fellow is great. He's in a great position as well, and that's the other thing. You have a great supportive person alongside you along the way. You're not alone in this fellowship, so that's also very a nice part of being an Inova fellow. But yeah, I'm very excited to stay with the health system, and I don't think I could have landed a better spot and a better fit for me. So I just encourage anyone who's applying to fellowships, just find the right organization for you, and it's definitely a great journey.
Thanks again for coming on, and let's stay in touch. We'd love to have you back on again in the future as you progress to your leadership roles.
Of course.